Hi, everybody. Welcome to today's discussion on COVID-19 and pets. I'm Heather Fields with VitusVet, and I'll be your host for today's session. And I wanted to thank you for joining us. Many of you are VitusVet app users, and we're really thrilled to have you join us today for this conversation. I'd like to introduce today's speakers. We have Dr. Stephen Walczynski and Dr. Mark Alcott, who are joining us today to answer the questions we received from our consumer survey. We received more than 800 questions from you, and we were just amazed at the breadth of questions. So we took a look at those. We've kind of distilled those down into common themes, and we're going to try to chop through as many of those on today's session as we can. Before we get started, I wanted to let the doctors introduce themselves so you'll have a sense of who is going to share information with you today. So why don't we start with you, Dr. Walczynski?
Well, thank you, Heather. Thank you for having me. I'm happy to be here and help all the listeners to work through some of the misconceptions that is going on with the COVID-19 virus right now. My name is Dr. Walczynski. I've been an owner and part of Rocky Gorge Animal Hospital for the last 35 years. We're a large hospital in Laurel, Maryland, and ER hospital as well as a general practice hospital, and take care of many of the pets in the community. And so hopefully we can help to answer these questions for you.
Great.
And I'm Mark Alcott. I'm a veterinarian and the co-founder of VitusVet. I grew up in upstate New York. Like many veterinarians, it's the only thing I ever really wanted to do. I think I started cleaning cages when I was 12 or 13 years old, and went to college in Western New York, vet school in New York as well, and then moved to Maryland. And I've been both a general practitioner and an emergency vet over my last 25 years as a veterinarian. And again, thanks, Stephen, for being here today so we can talk about this and answer some people's questions.
Sure.
Okay, great. Well, before we dive in to the questions, I just wanted to let our audience know what we're going to cover. So we're just going to take a few minutes to talk about the survey and some of the findings. I think we know that we had thousands of people respond. They spent about 5.5 minutes filling it out. So I think we have a vested interest in sharing back what we learned. And then we'll dive into the Q&A. So Dr. Alcott, you'll ask questions of Dr. Walczynski back and forth. And then we have some tools and some resources that we want to recommend to our audience as well, so they can continue to monitor the situation and know where to turn for trusted information. Okay, so Dr. Alcott, I'm going to turn it over to you to walk through the survey findings, and just tell me when you want me to advance the slide. I'll be happy to do that for you.
Will do. Okay, yeah, let's start off with the first slide. So this is really interesting. I mean, as Heather mentioned, we asked a number of questions. How concerned are you about how the coronavirus might affect your pet? A small number of people are extremely concerned, but certainly the largest section of people, a third of respondents, were that they weren't concerned at all. And I hope that's a theme that comes through in today's question and answer session, is that while there are a lot of questions about the impact of coronavirus on the pet population, and can pets give it to people and so forth. I think people are right to believe that they shouldn't be really concerned about pets being a source of coronavirus for themselves. And we'll talk more about that today. So I think what's interesting here is while they weren't concerned, they still had a lot of questions, right? And what they're wondering about specifically. And I've gotten this question personally myself too. Does coronavirus stick to pet hair and fur? We'll talk about that. Can the virus stick to pet food bags? How can I keep my dog sane now that I'm home 24/7? Probably applies to kids too. Can my dog play with other dogs as long as I stay 6 feet away from the owners? These are all questions that we'll be talking about here today. So we used your questions to build the database, and we'll just walk through them time allowing. Has your schedule for pet playtime, walks, or daycare changed? Perhaps not surprisingly, a lot more pet playtime at home for people as they're home themselves. I think having pets is great to keep people sane. They're great for me, I know for sure. And we've also seen, we'll talk a bit about this as well, that there's been an uptick in adoptions as well that we're seeing nationally as part of a response to this. So that's wonderful. and people that are taking their pet out for exercise or play more often, and taking a lot more pictures of their pets as well. So those were certainly the two largest responses. Not surprising, half of people said that they were taking their pets out for exercise or play more often. One of the things that we're doing every day is, I've got 4 dogs that need a lot of exercise. So we're going to a park, and we found an area that there's no other people around, and we can let them run around a little bit and burn off some steam. That's good exercise for us as well. And we do that every day as a way for the kids and the family to just kind of get out of the house, but still social distance. Also, since April is Pet First Aid Month, we wanted to ask the question about, do you have a pet first aid kit? And 70% of people said no, they don't. So hopefully that'll be an outcome of today's conversation. At the end, we've got a link to show where you can go and get a list of things that should be part of a pet first aid kit, because everybody should have one. All right, so now let's move on to the questions. We'll dig into some of the specifics here. And the first question I have for you, Dr. Wilczynski: my dog is acting different now that I'm at home all the time. She's pooping in the house more often, and I can't figure out why. Could it be related to our changed behavior of being at home?
Well, yeah. I mean, just like our lives have changed, so has the lives of our pets. And so it's confusing to them because they don't even know why everything's changed and why we're there more frequently. For the most part, from what I've heard from most of the pet owners, is behaviors have improved, not gotten worse, because we're home more for our pets. We're not leaving them home, but certainly changes in behavior of our behaviors and being around all the time is there. But for the most part, that's a positive, not a negative. You know, our pets are so important to us, and especially in this time with quarantine and pandemics, and having them there for our mental health is really so important. So I'm sure this behavior is probably going to subside very quickly. So I would not be concerned about that.
Yeah. Yeah, that's I would agree with that for sure. And a kind of a follow-on question to that is, will my pet become sad or depressed after we all return to work? So on the other side of this, what is that going to look like? And yeah, what do you think about that? I mean, thinking forward, we don't really know when, but once we do return to somewhat of a normal day in, day out schedule, how do you think that's going to impact our pets?
It will, because again, it's another transition, and probably more difficult transition for them. Because now they're thinking, well, this is great, you know.
Right.
I have my owner home with me all the time, and now
what happened? Where'd you go?
All of a sudden you're gone, and so that transition is probably more concerning. And so once we figure out, you know, when the transition period will happen, I'm sure we're going to have a little bit of leeway. Then I think we do have to do certain things to get our pets ready to be alone more at home. So, you know, possibly giving them some more time alone when you go out and social distance by walking and things like that. So they're getting a little bit used to having more time by themselves, I think would probably be smart to do. But you probably will see that. It's just like any kind of transition when there's a change in, you know, a pet that's a loss in your house and one pet leaves. It takes a pet a week or two. So probably when this all happens, it'll be about a week or two before the pet to readjust. But pets readjust way better than people do, and they'll readjust back to how the environment was before. So, so I wouldn't be overly concerned about that either.
Yeah, maybe that's I would add on to that. Maybe like once you have some visibility into when that's going to happen, you know, reach out to your veterinarian and ask them if they have any particular recommendations about how to manage that transition. Dogs with separation anxiety probably going to be more significantly affected than a dog that's not. So hopefully that's a theme that comes through today. Use your veterinarian as a resource. They're there. They know all the answers to these questions, and they're not too busy. If you have questions, call them, text them, however you use to reach out to your veterinarian. They're there for you.
Well, we're happy. We're happy. Absolutely. I think all veterinarians are happy to answer the questions right now. If anything, we actually have more time now to talk, and we want to help the clients and be out there and do that. You know, one thing now that we're seeing, which is interesting, being home more, and you talked about some of the other behavioral issues you can have, like separation anxiety, is puppies. A lot of people are trying to get puppies right now because they're
Right.
home and they have time to train the puppies, but
Yeah.
they're home all the time. When you have a dog that you've had for a number of years, they'll adjust to get back to how the routine was in a relatively short period of time. But if you get a new puppy and you're spending every minute at home with that puppy through a really important social period in their life, because puppies for the first 6 weeks of their lives is equivalent to a child's first 3 years of their life, pretty much. So if you're home all the time and you don't give them that alone time and getting used to be alone, those are the dogs you may have an issue with as far as having certain behavioral problems. So I would say, as you're training your new puppies, be careful about that and give them the time alone.
One of the themes that came through these questions that folks had is a lot of people are aware about the story of the tiger that got COVID-19, and what is that, or how is it relates to our own personal cats. So Stephen, maybe you could share with us sort of what you know about the coronavirus and tigers and cats, and how we should think about that as pet owners.
Yeah, we got tons of questions from clients, understandably, when that came out, because everybody got concerned about their cats at home. So the first thing is that everybody should know is, at this point, there's not a single case of a pet, cat or dog infecting a human with COVID-19. So considering that as of today, I think there've been like 1.5 million cases around the world of COVID-19, you would think that would happen. And so looking at this virus, and they've looked at it, cats are more likely to get coronaviruses than dogs are. So for the most part, most experts feel dogs really are not going to pick up this virus and carry this virus or get sick from this virus. Cats will pick up this virus potentially, and that's what happened with the tigers, but they won't transmit it back to a person. Also, the cats that have gotten this virus has been very mild symptoms. I mean, the tigers just had mild respiratory symptoms, and the few cats that are out there had very mild symptoms. I think there's been a handful of cases of domestic animals that have actually got this around the world there. So the odds that your pets are going to get sick from this virus is very, very, very low. And the cats that have gotten sick, it's been very mild and they've recovered relatively quickly. And there's been no instances of these pets transmitting this back to people. Now, that doesn't mean you don't want to be cautious if there is COVID around. And as far as keeping your pets clean and all that, and there is a recommendation out there that if you do have COVID, that it's possible that you might want somebody else to help care for the pets at that time. But at this moment, there isn't any evidence to do that. This virus is an interesting virus because it's an RNA type virus, that envelope virus. It lives on hard surfaces for longer periods of time, but on softer, porous surfaces, it doesn't live very well at all. And the fur of your pet is a soft, porous surface, and it's got fat inside of the envelope, and so that gets absorbed into it, the moisture, and these viruses die relatively quickly on your pets. So the odds that you're ever going to come in contact from it on your pets is low, and if you do, the chances that you'll get it, nobody's ever shown that to happen.
Right. Yeah, that's an adjacent question, right? The term we use for it is a fomite. In other words, could your dog spread it to you without actually having it, but they just carry the virus from an infected person to you? You pet your dog and pick it up. So I guess what, Dr. Wilczynski, would you call that as maybe theoretically possible, but extremely, extremely unlikely?
Exactly. The possibility is remote. It's never been really shown to happen. Yeah. You're going to read about saying dogs, especially because dogs really seem to not pick this virus up, but yes, it can live as a fomite on the fur. Potentially, they showed the RNA of the virus in the stool of one or two dogs, but not the virus itself. So there was questions about, would this be in the stool of the pet? And would not be contagious from the stool back into a person, even if it's possible. So I agree, Mark. I mean, remote at best.
Yeah. So how would you, that said, what are your thoughts on dog parks and other such stuff?
So personally, I probably would not be taking my dogs to dog parks now for a couple of
Yeah.
reasons. One, we really want to be quarantining ourselves more than that. So I worry about contact with people, even though we try to keep our distances. So that's difficult. And then you are putting your pet in contact with other pets that are in households that potentially have something. Again, we just said that it's remote, but I don't see a reason to take that chance. Personally, I would take my pets out in the backyard, places like that. The chances that your pet's going to go out and walk around places where there aren't other pets and pick up this virus is even more remote when you take a look at it. Because the problem with cats, and the reason cats likely don't transmit it back to people, is when you look at the amount of virus that's actually excreted from a cat, it's extremely low, which is why it probably doesn't get transmitted back. So, and that's with direct contact. So if you're walking someplace in the street, the chances that your dog's going to pick it up on their paws and then transmit it back is, like I said, is not something to really be concerned about. There have been some problems in other countries with trying to disinfect your dogs when you bring them inside, that sort of thing. And they've been putting all sorts of toxic type disinfectants and chemicals on your dogs. So the recommendation is, if you're concerned, then you should wash your dog off, because again, this virus is not hard to kill. And so if you just wash them off, even with soap and water, then you will get rid of the virus.
Yeah. Yeah. In fact, that was a question we had too, right? Can dogs bring virus into the home via paws from walks? So good question. It's what's funny is especially for folks that aren't scientists, you hear Stephen and I talk about this. It's sort of drilled into us, like, unless you have the data to say a firm no, you won't hear a firm no, and a lot of these things, has there been a scientific study to prove that a dog cannot bring the virus into the home via paws? No. But everything we know about the disease and all of our experience, everything we've seen in other countries and whatnot, is it something that you should be concerned about? No. It's just, I can't prove it. Would you say that's kind of a good summary, Stephen, on the scientific mumbo jumbo?
Absolutely. And there have been studies that have been done in Hong Kong and other places where the virus has. And so it's hard. It's hard to, for pets to transmit.
We don't know.
You don't really know. But even in laboratory conditions where they try to transmit it, even when they tried felines to transmit it to other felines, with a huge number of viral particles, it was only 1 out of 3 cats that would actually even pick up this virus inside of them. And again, they were shedding very small numbers of it. So again, you're right. We don't know. We never wanted, in a zoonotic disease, so a disease can be passed between people and pets. You never want to say never, really. But Mark and I have both lived through some of these times. We both lived through when feline AIDS was first discovered out there, and everybody was really concerned. Would it be transmitted to people? Right. So that concern's out there. So until we can say 100% no, you always want to be cautious. But there's no reason why you shouldn't be hugging and playing with your pets in your household, because and they're with you and they're isolated with you.
And interestingly, also back quickly to the tiger conversation, the tiger caught it from an infected handler. So that was a one-way transmission from human to the cat, which I would see and periodically, get dogs that would be brought in to be tested for strep throat, where there's a rash of strep throat in the family, and the physician is concerned that maybe you're picking it up from the dog. So should we swab the dog? And Stephen, correct me, if I'm wrong, but just as often as not, if the dog was positive, the family had given it to the dog instead of the other way around.
That's correct. Strep throat was interesting because I have some good friends that are pediatricians, and was trying to go back and forth with that. But they actually found, I don't know if you heard this, Mark, what's interesting is most dogs that ended up getting strep throat and everything got it from their anal glands, from licking the anal glands.
I didn't see that. That makes sense.
And nothing to do with transmission back and forth to people. So.
Oh, yeah. Yeah, I remember there's like a wave of that a few years ago where it seemed like every week somebody in flu season, somebody was coming in to have their dog swabbed, and we didn't know back then, but that makes a lot more sense.
I even
Yeah.
had some older pediatricians that would tell people, oh, if your child got strep throat continuously, they would think about getting rid of their dogs. So yeah, it was awful.
All right, let's see some other questions here. We have around my pet has some concerns. Like in this one particular case, there's a change in skin color or eye discharge yellow green, but they're afraid to go to the veterinarian. What would you say to those clients, Stephen?
So veterinary hospitals are running differently now than we did before. Most veterinary hospitals are seeing sick patients, but we're seeing them without having clients come into the office. So if your pet is sick and you're concerned, most hospitals have protocols in place that it is fine to bring your pets in. If you call the hospital, make the appointment. Most of them are having somebody come out and get your pet from the car, bring it in, and then they'll have discussions with you either through a telemedicine or telephone or some manner of communicating so you can talk to them in the office. I've done lots of these over the last few weeks. They work well, and most pets are getting the same care. It's a little odd. Pets are feeling a little strange when they walk into the room without their owners, but it works fine and everything. What we're not seeing is routine elective type procedures right now, mostly because we really want to preserve the resources that we have for the human side. So we don't want to be doing things like elective procedures. There was a question we saw about spays and neuters are on there as well. And
right.
So we don't want to utilize gloves and masks and things like that at this point, unless we are doing surgical procedures, and if there's emergencies, they'll be done. So it's really just about elective procedures, which in most cases can wait, especially with spays and neuters.
Yeah, say something about that. I would think people are concerned about, if I have to wait a month or two to have my dog neutered, is that a big deal? Or my female dog spayed? Maybe you could talk a little bit about that.
Yeah, definitely not. Certainly for neutering, it's not a big deal at all. And so waiting a couple of months is not going to be any negative effects. In females, it's just if they happen to go into heat, then dealing with them being in heat. Obviously, they're being isolated now, so you're not worrying about pregnancies, with the female dogs at this point. Certainly, there is huge benefits to having female dogs spayed. But over a couple of month period of time, those concerns that we care about, things like infections in the uterus and possibly breast tumors, things like that are not really a concern that we care about at this point. So again, there's no reason to do that. There are certain things that we are mandatory, and depending on what state you're in, state of Maryland here, where certainly rabies vaccines, and there's leptospirosis is something that can be transmitted between people and pets, come in for those because that's considered mandatory. Any diseases that are, again, zoonotic that can pass from people to pets, we're still doing.
Yeah. Yeah, that's very important, especially those diseases. And lepto in particular is kind of on the rise. It's a nasty disease. I mean, when you look outside the United States, worldwide, it's extremely common disease. We have vaccines for it, and it's the L and the DHLPP that that many of you may know from your dog's distemper vaccine. So it's really important that they have that. And that's something that we're seeing is on the rise. I mean, have you seen cases of that, Stephen, or is it something that it's on the rise, but it's, you're not seeing it like Lyme disease or something?
Definitely not seeing it like Lyme disease. Lyme disease is something that is the most prevalent infectious disease that we see right now. If dogs are not vaccinated, up to, depending on where you are in the world or in here, at least 20% of dogs will be positive for Lyme there. But leptospirosis is a bad disease, and even though the incidence is still relatively low, it does cause kidney failure, hepatitis, and it is contagious to people. So if you're around your dog and you're petting your dog, you can get leptospirosis, and that's really a bad disease to actually get. So those kind of vaccines, if making an appointment with your veterinarian, and we'll be able to do those vaccines. And most veterinarians, if they're due for those vaccines, will be able to do the other vaccines at the same time. So you won't have to come in for an additional visit and worry about your pets potentially getting sick more than once, or not feeling they're as good as they could more than once because of the vaccines.
All right, so let's ask a question about food contamination. How do we handle new food shipments? Do we need to wipe down boxes and bags? How are you?
Yeah, I would tell people, anything that they're touching like that, that's coming to either you're getting it yourself or it's being delivered to your house. I don't see any reason why you wouldn't want to just kind of wipe down anything that comes to your house just to be safe. It's easy to do. Again, it's not hard to kill the virus. Any of the common disinfectants or even alcohol that's out there, within anywhere from 1 to 5 minutes, depending on the disinfectant, will kill this virus. So no reason not to do that.
Yeah, if it's coming into your pod,
right,
clean it up. Yeah, that makes a lot of sense out of the abundance of caution. Yeah. Here's a great question here that was really thought-provoking for me. What happens to my pet if I get hospitalized? What should we tell people who have concerns about that?
That's a great question. And really it's just to be preemptive about it and have plans just in case. We've had a number of clients that have called us who live alone, who don't have, if something happens to them, they're worried about their pets. So I would make those plans in advance, and just God forbid something happens to you. So call your veterinary office and talk to them, and I'm sure that any veterinarian will go in and take care of your pets in case anything happens while you're in the hospital. But again, it's just making those plans in advance so you don't have to worry about it, because if you've had the virus and then something happens to you, then people don't want to come to your house, and it tends to be a problem. But yeah, it's a good question.
Yeah. A couple of related questions here. We touched on it a bit, but maybe we could circle back to it. This one pet owner is thinking about getting a new puppy. Is this a good time? And then a related question around, what are ways I could socialize my puppy safely?
So if you were thinking about getting a new puppy, then yes, this is a good time to get a new puppy. If you're not thinking about getting a new puppy and you decide, oh, well, I'm home all the time to get a new puppy, that is always a bad idea.
Right. It's like a Christmas time.
Right.
Puppies.
Life will get back to normal. And so you really need to think about the long term for your life, and certainly for the pets, the puppies. This is a time where we worry that all these people are going to be adopting new pets or getting new pets, and then they're going to end up in shelters and places like that. So please, take that into consideration there. And, but again, since you're going to be home all the time, if you were thinking about getting it anyway, it's a great time for you to be able to train. Actually, it's a great time for you. All those regrets that we all have about what we could have done with our pets when they were younger that we didn't do. Well, now you have time to do them. So, that whole thing with old dogs, new tricks is not true. It takes a little bit longer, but you can teach your pet things right now. And you can have all sorts of fun with your pets right now too. I knew there was a question also about different things you can do with your pets, games you can play. There's even dog TV that's giving I think a 30-day free trial that for people. There's all sorts of games you can do, people doing scavenger hunts. I saw on social media people are doing things like taking treats and putting them like the shell game. Take Easter egg type things and put it underneath there and just moving it around and then see if your pet can find it and everything. They usually look at you like, what's wrong with you? I could smell where it is. I don't have to actually see where it is too, but it's
right.
It is fun to do that.
Really? You're going to make me jump through this hoop? Yeah.
Right. Exactly. Cats love to stalk, play stalking games with them, do things like that also. And so, while we're home, we have time, just like we're spending more time with our families now and connecting with them. We're all connecting with our pets. So this time is going to pass and we're all going to get back to our normal lives soon. And then we're going to say, wow, I wish I would have taken more advantage of it. So while we're in it now, let's have fun, take advantage of it.
Yeah. For those of you with cats, if you don't have a laser pointer or haven't played that game with your cat, that's a good time too. Yeah, this would be a great opportunity for that. You don't need a TV if you have a cat and a laser pointer. You can occupy yourself for quite a while. It's fascinating, like the most sedate, calm cats, they see the laser pointer and boy, do they spring to life.
Yeah, it's fun. It's actually fun to watch them too. One other thing with other pets that I wanted to mention that we didn't cover also is because some people have other pets besides dogs and cats out there. One interesting pet is a ferret. Ferrets are interesting because ferrets actually have been used as a model for influenza virus because they tend to pick up human influenza virus. So there's a lot that's been done on them with research side. And it turns out they actually also pick up coronaviruses, and specifically they do pick up this COVID-19 virus as well. I couldn't find anything to say whether they can transmit it back to humans or not. So I would be cautious about ferrets because there's nothing published. I don't think that's been looked into yet as well.
Yeah.
But ferrets are susceptible. So anybody with ferrets out there, you do have to be careful as far as that goes. But other pets.
Yeah. What about rabbits? There was a question about rabbits. You know anything differently about them, or are they?
Yeah,
the same
I didn't see anything. I don't think rabbits. I don't think any of the other pets that are in household type pets and small pets that are there have not been shown to pick up the coronavirus as well. Ferrets are really unique. They tend to pick it up more than others. And like I said, felines, cats, for some reason, are very prone to picking up coronaviruses in general as well. There's a lot of work done with the SARS virus in the past with it, which makes me more confident that it's probably not transmissible back to people, because that's really been proven that SARS, which is a very similar coronavirus to the COVID-19 in cats, cannot be transmitted back from the feline population to humans, but they picked it up just like they do the COVID-19.
All right. Question, will my vet do video calls? What are you hearing about that?
So a lot of vets are starting to get telemedical platforms in place right now. So most veterinarians will either do video calls or video platforms, or if not through video, they'll be able to through telephone, text, Zoom as a video protocol. Veterinarians are trying to figure this out right now. It's tough because telemedicine on the medical side as a doctor doesn't feel right. If we can't touch it, feel it, see it, hear it, it doesn't seem right as well. But it is a protocol that's been used in humans now for a while. So veterinarians are now beginning to adopt that. And we're just trying to figure it out. I'm curious for the users when you listen to this to really think about it, because you're going to see a lot more of this. And what are you willing to do with this? Are you willing to pay for a video consultation the same way you would pay for an in-hospital one? There's been questions back and forth about that as well. We've been very good as to talking to our clients forever and not charging anything for it. Well, now if you're not coming in, are you willing to pay for that? So it's something I would start thinking about on your own, because those questions are going to come up between you and your veterinarian.
Yeah.
But it's out there, and it's going to become more reasonable. And certainly during these times, you're going to see it available and a way to communicate, just to be sure. Because when you see something happening with your pet, when you see that nasal discharge, when you see something, you want to ask the question, do I need to come in or not at this point? Is it worth taking the risk for me to go out and come in? Is it something I need to do? And again, we're here for you to ask those questions to us and every veterinarian I've spoken to out there.
Yeah, that's great. Well, we've covered a lot of the topics that our users had. Yeah, Heather, I was going to turn it over to you.
Yeah, I just wanted to ask. So some of the folks wanted to know, were they bothering their vet or the vet staff by coming in to get like their heartworm and flea and tick? Should they get that elsewhere? I think there's just some concern and reluctance, like, should they come in, or, is that a bother right now? So curious what you think.
Absolutely not a bother. We want to be, the primary place that people come to A, ask the questions, and B, if possible, for you to be able to get your pet medications, and for us as well. Veterinary hospitals are, they're slower now. We're trying to keep everybody employed. So quite honestly, if you buy your products from us and it's reasonable, then it keeps people employed in our hospital. And we want to keep everybody employed through all this so we can get back to normal.
Yeah, great point. Yeah, supporting local businesses, great point. Yeah, for sure.
But yeah, we ask us, do not feel bad. Call us, bother us. We want to be bothered. We love talking to you. We feel the same way you do now as far as what's going on out there. So the more social interaction we can have, even if it's not the way we once knew it to be, we're happy to do it.
I think shopping local is definitely something that could be a silver lining of this situation. And I know from a lot of the practices we work with, they actually can ship those items too directly to you. So or they bring it right out to your car. So great. Thanks.
And we do both right now too, and deliver. I know most hospitals will do that. If they can't ship, then they'll at least bring it out to your car for you. If you just pull right up, they'll bring it right over to you, so then it'll be ready for you. So it'll be fine.
Great. So I just wanted to throw a couple more slides out here for Dr. Mark to wrap things up. I think there's some opportunities here with our pet owners to maybe remind them of some things you could do right now to manage your pet's health, but also year round. So I'll let you cover this, Dr. Mark.
Yeah, we talked about the importance of the annual wellness exams and a couple of the components of that, especially around rabies and lepto, that are really required, or if not legally required, at least substantially required. And so I follow your veterinarian's recommendations on that. And, if your practice is using an app, that's a great way, or texting, a great way to minimize the phone call volume. Especially one great thing about using an app or texting is it's a great channel for when you think of something and you want to ask that question, or you want to set that appointment real quick, even if your practice is closed, or if you don't have the time to jump on the phone right then and call your veterinarian. If your practice has an app or is using texting, that's a great channel to be able to get your questions answered or set up appointments as needed. An opportunity to get your pet's medical records. One of the cool things about our app is it allows pet owners to get a copy of their medical records and store it on their app. So heaven forbid, if they find themselves in an emergency or if they're traveling, they've got access to that kind of information. And also, it's a good time, if you've got some time on your hands, to create the pet first aid kit. Every pet owner should have one. There's a great link here, this bit.ly link down here. We have a piece of content that has recommended pet first aid kit content. So take an afternoon and put something like that together. Hopefully you'll never need it, but better to be prepared and than to not be prepared when something happens. So this is something that we recommend for sure.
Great. And then again, I think just the sheer volume of questions we got that's why I added this slide. I think it's important just to reinforce, like, where do you turn? So this has been great. We've answered most of the big themes, but next week, 2 weeks from now, next time something like this happens, like, who do you guys trust? Who do you recommend to our pet owners? Where do they turn?
Well,
yeah,
I think
Stephen.
No, that's fine. I think initially, calling your veterinarian and getting information from your veterinarian is fine. I think what you've listed here, the CDC and the World Health Organization, the AVMA, all are great resources out there as well. It's still scary, so it's nice to be able to call your veterinarian and to talk to somebody directly that you have a relationship with.
Right. Yeah. Yep.
And I think having that, I think really makes a difference. I think having this webinar is great also, because at least we can give good information for people out there to really know what's going on, and then look at your veterinarian hopefully on their website, or some veterinarians are putting out blogs. We are, and others, to talk about this disease as things change, or if things change, to stay tuned to that.
Okay, great. Well, I want to thank you guys both for joining us today and answering a lot of the bigger themes that we got out of the survey. But before we end, I just wanted to give you each an opportunity. Are there any final thoughts, anything you wanted to share before we wrap things up here?
I just want to thank Stephen for taking some time to be with us here today and answering these questions. Yeah, thank you.
Well, thank you for having me, and I want to make sure everybody does what they can to stay safe. What's going on in the world is great to see that we're all doing something that we've never done before by isolating, and again, take the opportunity to spend time with your pet. Our pets are out there saying, this is the coolest thing that's ever happened. And so enjoy these times. It's like when tragedy hits, whenever in our lives, got to look at the silver lining of it. And the silver lining is that we get to kind of cuddle up and hug our pets and spend time with them. And as we've talked about today, for the most part, safely.
Absolutely. Okay, great. Well, thanks again to both of you. I appreciate it. Thank you to everybody who's tuning in to get answers to questions. And we hope everyone is well. If you have any other questions for VitusVet, or we can be of any service to you, just visit our website, vitusvet.com. Thanks so much, everybody. Have a great day. Take care. Bye-bye.